Welcome to our debate on the use of person-first language versus identity-first language. We will start with group members introducing themselves.
Hi, I'm Tyler Bunkley. I'm from Georgia. I'm an RBT clinician in clinic. I was a teacher at an alternative school, and I learned about ABA. I'm currently in my second year at Ball State.
Hi, I'm Diane Charamella. I live in New Jersey. I started my career as a special education teacher and a behavior specialist, and now I'm a special education administrator in a public school for pre-K through 8th grade, and we have multiple classes for learners with autism. I also work in home settings doing ABA under the oversight of BCBAs, and I'm in semester 3 at BSU working towards my BCBA.
Hi, I'm Stephanie Espedia, and I'm from Georgia. I'm a student analyst and trainer in clinic, currently focusing on early intervention. I have worked in the ABA field since 2020 in home and school and now in clinic settings. This is my 4th semester at BSU in this graduate program, working towards my end goal of becoming a BCBA.
Hi, I am Allison Goff. I am from Alabama. I am currently a case manager for an early intervention ABA clinic, where I currently oversee a small caseload of my own. I've been in ABA for 3 years, and I am in my 4th semester at BSU with hopes of pursuing my BCBA.
Hi, I'm Brenna Woodall. I'm from Indiana. I'm a trainer at an ABA clinic, which includes training new RBTs, ongoing training for current RBTs, and assisting with programming for clients. I have been in ABA for 3 years, and this is my second to last semester at Ball State, and I'm working towards becoming a BCBA.
Today, we're going to discuss the topic of person first versus identity first. The most appropriate way to talk to a person with autism is highly debated. Centers for Disease Control and Prevention in 2022 stated, disability is part of a human experience, and people use words or phrases that are insensitive or that are not intentional, but can be disrespectful at the same time. It is important to know that preferences can vary, and it is important to ask a person how she or he would like to be described. Together as a group, we will explain pro-person first with 3 key parts, and then review identity-first language. We will bring forward pro-debate points and supporting evidence for its use, as well as con-debate points with supportive evidence from research. This will be followed by an attack of each debate side, followed by the closure, in which we will provide conclusionary ideas. We will address questions as a group formulated for themselves at the end. Now I will go over the roles in the debate. First, the preview will be Tyler. Stater person first is Diane. Attacker is Stephanie. Stater identity first is Brenna. Attacker is Diane. And the moderator is Allison. First, Diane will share information about pro-person first language and 3 supporting points as to why person first language is the best way to address people with a disability.
Person first language always identifies the person to whom we're referring before stating the disability associated with that person. That holds true when speaking or writing about an individual. Some examples of person first language are a child with autism, a person who has Down syndrome, a student with ADHD, and a student with cerebral palsy. As you can see from this chart by Independence, Inc., there is correct verbiage with which to identify an individual through person-first language. Notice that the person is labeled first, followed by the condition or the disability with which they're afflicted. So we would correctly say people with disabilities instead of handicapped people, or she uses a wheelchair instead of she's wheelchair bound. There are several reasons why PFL is the best way to address people. First, using person-first language avoids stigmatization. Boujman et al. Explain West's position that PFL encountered stigmatization as it emphasizes the humanity of someone rather than their autism. Labeling a person with autism literally puts autism behind the person, which is meant to promote the view that people with autism cannot be defined by their autism alone. As Crocker states in the Journal of Multidisciplinary Healthcare, how we treat individuals with disabilities begins with how we speak about them. By first stating the person type or the qualifier, such as a boy or a girl or a student, and then following that title with the disability type, we can avoid over-focusing on the disabling condition. An individual is not defined by autism, so the identifying disability should always be secondary to the individual to avoid stigma. Second, we can promote opportunities for individuals with disabilities by reminding the community members and society at large that we're referring to people first and foremost when considering options for equality, which can impact areas such as social acceptance and employment. To reference Crocker in 2019, once again, the intention is to decrease the focus that is placed upon the diagnosis and increase the focus on the person with the diagnosis. By decreasing the stigma of the disability, there's hope that greater equality will exist. Third, person-first language is the standard in written language across the disciplines. According to Crocker and Smith, person-first language can be found most notably in scholarly journals. Most scholarly journals now require that articles submitted for publication use person-first language. In addition, according to Crocker, most scholarly journals now require that articles that are submitted for publication use person-first language. Person-first language is the standard in writing because it pushes toward individualization and it avoids standardized treatments. A variety of informative style guides also recommend person-first language. Two of these are well known, the American Psychological Association and the Speech and Language Hearing Association, and they both state that writers and speakers use only person-first language and avoid completely identity-first language. If we need to write in person-first language, it stands to reason that speaking in person-first language should also be the expectation.
Thank you, Diane, for sharing those 3 points supporting the use of person-first language. Next, Brenna will talk for the con side supporting identity-first language and the reason that identity-first is the way to address people with a disability.
Identity-first language places the person's disability first. For example, an autistic individual or a blind person. There are a multitude of reasons why identity-first language is the way we should address disabled individuals. There are First, disabled individuals see their disability as a part of their identity. 40% of autistic adults preferred identity-first language, while only 18% preferred person-first language. As the autism rights movement rises, the idea that autism forms a large part of a person's identity makes an argument that identity-first language would be more appropriate as the community is trying to advocate that their deficits should be seen as part of their differences and strengths. In a study by Lee and colleagues observed, in a study performed by Lee and colleagues where they observed discussion forums they created for e-learners, 20 out of 37 autistic learners identified that they preferred to be identified as autistic. If we believe that disabled individuals should lead the discussion for how they like to be identified, it is clear that identity-first language should be used. Second, identity-first language creates a positive self-image. In the English language, the more positive attribute is usually placed prior to the noun. By using person-first language, we may promote the idea that autism or any disability may be something negative. On the other hand, by using identity-first language, you are empowering a disabled person and encouraging them to advocate for themselves. Boojman and colleagues state that person-first language can maintain and at times induce stigma and ableism. Third, identity-first language helps disabled individuals identify resources. By using identity-first language, disabled individuals are able to embrace their disability. By embracing their disability, they are more comfortable sharing it with others. Stakeholders and professionals believe that teaching children to embrace and disclose their disability will help them use their diagnosis to their advantage and find resources that will help them in everyday life. Using identity-first language helps it further encourage people to embrace their disability and not be ashamed of it.
Thank you, Brenna, for sharing those 3 points supporting the con side of identity-first language. Now, Tyler as prover will go into greater depth about the pro debate points.
First point in support of person-first language is that the use of person-first language avoids stigmatization and promotes dignity of the individual. What you call people is how you treat them. The words we use shape how we think about the world. Every word conjures an image in your mind, so what we call something does matter. The push for more appropriate or inclusive language has garnered more support in recent years. We have acknowledged the significance that the appropriate pronouns and titles have to the individual. We've seen how important it is to various groups. We have seen the impact of inclusive language, and while the use of a person's preferred language or pronouns is a cultural war to some, to others is their identity. What we call people is how we treat them, and people want to be treated as human. Some self-advocates commented that they preferred person-first language because they felt that they were not defined by their autism. The person is the focus, not the disability. If you've ever been in a group with two people with the same name and one gets the addendum of a big or little to differentiate the two, this feels somewhat dehumanizing, as if your name is the secondary characteristic and a physical attribute is who you are. Taken to the extreme, these types of labeling reduce the person to a small facet of the whole complex individual. In person-first language, the person is identified first, not the disability. The disability is one aspect that makes up the individual. As we have all heard, see the able, not the label.
Thank you, Tyler, for sharing the first point in the pro side of the debate, supporting person-first language. Now, Stephanie will attack against avoiding stigmatization, promoting dignity in the individual for identity first and person-first language.
Using identity first is not name calling. The negative stigma surrounding disabilities such as autism is why there is an issue between person-first language and identity first. Person-first languages subordinates the disability to the individual. This is done mainly by individuals without disabilities wishing not to embarrass or make people with disabilities uncomfortable. Identity first returns power and respect to disabilities such as autism. In 2020, the Organization for Autism Research conducted a study on 1,072 individuals, 847 self-advocates, and 225 family, friends, and educators. Out of the 1,072, 81.4% of respondents preferred identity-first language, 88.1% of those respondents being self-advocates. By using identity first, we can work to remove the negative stigma from the disability names and instead allow them to be carried with pride and respect, as they should. Changing the stigma allows us to progressively move forward and remove the negative differentiation put on labels, distinguishing autistic and neurotypical people. The same issue isn't being debated and or researched on calling someone a Christian, Hispanic, Caucasian, Jamaican, Buddhist, etc. These identities are carried with pride and respected. Stating person first in these examples would separate the person from their inherent identity and in turn not allow the individual to be seen as someone who fully envelops who they are in a positive light.
Thank you, Stephanie, for sharing your first attack. Now, Tyler will discuss the second point in the pro debate for person-first language and promoting opportunity.
The second point concerning the use of person-first language is that it promotes opportunities. In recognizing that we cannot create language that will be immune from misuse, we seek to raise awareness on the importance of language choice. Use of people-first language and a focus on person's strengths, their abilities, skills, and interests can help reduce bias against those with disabilities, and its use reflects a shift in attitudes towards respect and dignity. No language will be perfect, but approaching this subject with respect and an appreciation for the intent behind doing so will go a long way. Understanding the intention is to value the individual in ways we have not done in the past. Both states, linguistic framing influences the way that people conceptualize social matters, political attitudes, events, and situations. This promotes opportunities for individuals with disabilities by reminding community members and society at large that we are referring to people first, and more importantly, when considering options for employment or acceptance in general. It puts the person as the central figure. On average, the person first terms children with inserted disability are used in scholarly writing 100 times more frequently in a PubMed abstract and Ngram books, 200 times more frequently in Google Scholar articles, and 700 times more frequently in Web of Science titles than the person first terms children without. The goal of bettering someone's life includes access to freedom, opportunity, and self-respect. By placing the person first in language, We put the person first in our mind. The individual in question is not the autistic employee who is doing a good job considering their disability. The employee is the individual, whole and complete.
Thank you, Tyler, for sharing Pro Point 2 for Person First Language. Now we will hear from Ms. Stephanie to attack against Pro Point 2 and promoting opportunities.
Words and language choice are powerful in society. While they can help us raise awareness and prioritize a person's strength, this is only needed because, as previously mentioned, there is so much negative stigma surrounding disabilities. Instead of focusing on how we can bring respect to an individual by separating them from the diagnosis, we should be focusing on bringing respect to the diagnosis so it can be carried and seen with pride. In the previously mentioned 2020 survey by Organization for Autism Research, 88.6% of self-advocates reported preferring content with material that use identity-first language. By organizations, research, resources, providers, etc., using identity-first language, they are creating more opportunities for autistic individuals to choose them, as it is seen in positive language. Neurology is not an accessory. Is displayed through this visual. An autistic individual is whole and complete. Their diagnosis is part of them, something that we as society should see positively. Doing so will not just aid in strengthening that individual's identity, but also strengthening the diagnosis. Earlier this year, Botha et al. Published Does Language Matter? Identity First versus Person First Language Use in Autism Research, a response to Vivaldi, and found that clear consensus on the least preferred and most offensive language, the specific person-first formulation of person with autism or person with autism spectrum disorder condition. Referring back to why many feel the need to use person first, they see the negative stigma surrounding the disability. An autistic person can be seen for their specific skills and qualities without having to remove their autism when directing them. When addressing Ethics Code 1.08, discriminating behaves equality and inclusively, using identity-first language and treating them with respect and fairness go hand in hand. It should not be one way or the other, as this adds to negative view of the diagnosis.
Thank you, Stephanie, for attacking the second pro point made by Tyler. Now Tyler will discuss Pro Person First Language Point 3.
The American Psychological Association endorses the person-first perspective in an effort to reduce stigma, stereotyping, and prejudice towards people with disabilities. The BCBA Ethics Code 3.01 states that we have a responsibility to clients to do no harm. The language you use matters in our speech and in our writing. Person-first language as the standard in writing, and it fights the notion of a one-size-fits-all mentality, according to Crocker. As mentioned, language shapes our attitudes towards issues, people, events. When the disability is prioritized over the individual, we create a monolith in our mind's eye. It erases the complex nuance of the individual. Since the label becomes the defining characteristic of that individual, it creates an associated image for all people with said disability. A society's opinions are shaped by the language it uses. In the past, demeaning and reductive terms were used to define the entire community. This did a great amount of harm to the entire population, not just those with a disability. The terminology associated with the individual's disability creates a mentality that did not value these individuals, and as a result, everyone was denied access to freedom, opportunity, and self-respect. We are more and more seeing the value that everyone has, and that there is a place, no matter the shape, for your piece to fit and help make the whole picture of our society more complete and complex. Stigmatization allows for more individuals. The destigmatization allows for more individuals to engage and interact with others. These follow the code's 5.01 of protecting the rights of client and stakeholders, supervisees and trainees, and prioritizing the rights in public statements. People thrive through support system. The support networks that prop up the ASD population have grown and changed over the years. As mentioned, our attitudes towards those with disabilities have changed over the years to include a more whole view of the person. This can be extended to the communities as a whole. By using person-first language to acknowledge the whole person, you are also acknowledging that the support system is made up of a wide variety of individuals and not just those with ASD. The support network or community for those with ASD certainly includes peers and others with a disability, but it also includes parents, guardians, teachers, caregivers, and friends. People often think of hospital staff and people in scrubs when mentioning disability, and while these helpers exist, it is more than a monolith. This network of support is there because of the person they love and not the disability they have. As a result, person-first language, by highlighting the individual first, highlights the diverse community around the individual.
Thank you, Tyler, for sharing point 3 for person-first language of this debate. Stephanie will now attack point 3.
In the article by Botha et al. Published earlier this year, Does Language Matter? Identity First versus Person-First Language Used in Autism Research, a response to Vivanti, they explained person-first language as involving the noun person followed by the with plus noun. Here, in this example, we'll use autism. Other nouns or noun phrases that may substitute in the second position for autism include those such as cancer, liver disease, a headache, COVID-19, etc. This is common formulation used to signify the presence of some kind of pathology or illness. Again, as we stated previously, the need to change wording when addressing a disabled person to person first stems from the negative stigma surrounding the disability. Instead of focusing on the issue of finding better wording to see autistic individuals in more positive light, we need to change the stigma surrounding the terminology. This starts by normalizing identity first language. Following Ethics Code 3.01, responsibility to client, do no harm, it is within our responsibility to not add negativity to the word autism or autistic when working with our clients.
Thank you, Stephanie, for attacking point 3 pro person first language. Brenna will now discuss con debate points.
Disabled individuals see their disability as part of their identity. As you can see in this visual, 81.4% of people surveyed preferred identity first language. 76.4% stated they would be more likely to utilize services that used identity first language, and 88.1% of individuals stated they refer to themselves or their loved ones as autistic or an autistic person. The next visual also shows a study that shows an overall preference for disability first or identity first language. Autistic individuals find that autism is a core part of their identity and have a preference for identity first language when describing autism within the autistic community. The word disability needs to be seen in a more prideful manner. Claiming to be autistic or an autistic person adds value to the disability while adding it to the person. For example, using the phrase "a person with autism" showcases the disability as something negative that can be detached. Boucher discussed in her book Autism Spectrum Disorder: Characteristics, Causes, and Practical Uses how the idea that it is a right for people with autism to have the, quote, right to be valued and respected on equal terms. With this being said, if autistic individuals prefer identity first language, using the language they prefer to describe themselves would be the best way to show them respect.
Thank you, Brenna, for discussing the con debate points. Diane will now attack this con point.
The first point made in support of identity first language was that disabled individuals see their disability as a crucial part of their personal identity and that they embrace their disability as part of who they are. Although a disabled person may not be ashamed of their disability, they continue to have the right to identify as people first and foremost. According to Vivanti, using person-first language stresses the person's unique combinations of strength, needs, and experiences, both related and unrelated to their disability, by literally placing the person before the disability. This does not remove the disability from the terminology, but re-emphasizes the person first, thereby retaining the identity, but reducing the stigma.
Thank you, Diane, for discussing support of identity first language. Brenna will now discuss con point 2.
Identity first language helps promote positive self-image in the disabled community. This visual depicts how we can see that using identity-first language shows that autism is a part of who they are, not something they can hold on to like an accessory. Burry et al. Discusses how autistic individuals have reported that being autistic is at the core of who they are and gives them a sense of self. Therefore, using person-first language helps show that it is not something outside of who they are. It is something they should be proud of. As stated previously, using person-first language can induce stigma and ableism. Identity-first language works to help disabled people claim their disability as a positive attribute and should be seen as a strength. Boucher also discusses the ignorance of people who are not autistic causes there to be a hostile environments and exclusion. By teaching people with autism at a young age that they should be confident in who they are as an autistic individual, they can have the confidence to stand up for themselves and stand up to this ignorance and help educate those around them.
Thank you, Brenna, for discussing positive self-image for identity first, second point. Diane will now attack this point.
It was espoused that identity-first language creates a positive self-image by placing the identity first, thus embracing their disability and not seeing it as a hindrance. This point can be counteracted by a Dutch study by Boujman et al. In the International Journal of Research and Practice, in which word preference in Dutch autistic adults and parents of autistic children was examined. The results indicated that person-first language was a preference identified by 71.4% of those involved in the study. Boujman continues by sharing, it has been argued that person-first language counters stigmatization as it emphasizes the humanity of someone rather than their autism. Furthermore, the American Speech and Language Hearing Association proposes that person-first language is less stigmatizing than identity-first language, and the American Psychiatric Association explains that person-first language can help reduce stigma.
Thank you, Diane, for attacking identity-first language. Brenna will now state con point 3.
As stated previously, Lee et al. States teaching children to embrace their disability and tell others about it can help them find resources that will help them in everyday life. It is important that disabled individuals feel confident in who they are and in their diagnosis. While they should be confident, being autistic can come with its own set of challenges that an autistic person may need extra help with. Teaching autistic people to stand up for themselves and take ownership of their disability and their needs because of their disability can only help them better understand what extra help they may need. As we have seen in my previous points, utilizing identity-first language is a great way to build confidence and take ownership over their disability. With confidence, disabled people are able to take ownership over their disability and ask for the resources that they need. While oftentimes autistic adults end up living with their parents, Boucher discusses a recent study showing that 87% of autistic young adults live with their parents in the years immediately after formative education, and 38 of those adults continue living with their parents in later years. It is important to teach autistic adults to advocate for themselves. Having an autistic child could cause various stressors for a family. By teaching an autistic person from a young age that their autism is something they should be proud of, they are more likely to, if they have the ability, go and help find resources for themselves, such as job opportunities, help in higher education classes, support groups, and other resources.
Thank you, Brenda, for discussing helping identity resources. Diane will now share her attack for the third point.
The third point proposed in support of identity first language is that the language helps disabled individuals identify resources needed. To identify and access resources, strengths and challenges can be identified and addressed, but stigma must be avoided. Referencing Crocker once again in the Journal of Multidisciplinary Healthcare, by focusing less on the diagnosis of the individual and more on the actual person, stigma of any disability is lessened, and in turn, equality is heightened. She explicitly states how we treat individuals with disabilities begins with how we speak about them. And when person-first language is not used, the patient's preferences, needs, and values may not be honored. It is clear to see that the use of person-first language supports access to needs and resources as compared to identity-first language.
At this point, both the person-first side and identity-first side have shared their sides and research to support. In addition, the attackers have attacked each point with research of their own. At this time, Diane and Stephanie will share a brief closure for the pro and con side.
In conclusion of pro person-first language usage, research shows that using person-first language literally puts the person ahead of their disabling condition, which results in the avoidance of overfocus on the person's disability, thereby decreasing the stigma. As Tyler, our prover, stated, some individuals surveyed by Lay felt that they were not defined by their autism and that the person is focus, not the disability. This information speaks volumes, and we as a community need to listen and respond by using person-first language. This language, in turn, increases the individual's opportunities for social advancement and more equitable treatment in society. As the stater, Crocker's 2019 article in Journal of Multidisciplinary Healthcare was shared, in which he argued that society can put greater focus on the actual person rather than their disability by avoiding identity-first language that tends to hyper-focus on the disabling condition or the diagnosis, which can lead not only to acceptance, but also equality. This may have a profound impact on equality in social circles, inclusion in educational settings, and even job opportunities. Last but not least, person-first language supports individualization rather than one-size-fits-all mentality. This helps advance the lives of people with disabilities, as they'll be more likely to get what they need to be successful rather than receiving what others in similar categories of that same disability may need. People are individuals, so let's recognize them and treat them that way by using person-first language in both verbal and written form.
And concluding for the identity first side, research shows that autistic individuals prefer the use of identity first language to be the norm within society. Bushman agrees that identity first language may actually empower people with disabilities, since it connotes a disability not as a problem, but as a part of the essence of the person. Therefore, person-first language, while trying to decrease stigma, causes more stigma and gives a negative connotation to the disability. The Organization for Autism Research provides us with recent numbers on the consensus about the topic. As previously stated, the majority of self-advocates agree or strongly agree with preferring identity-first language. Data shows that a person's disability can be a major part of their life and who they are as a person. Disabled individuals and stakeholders, such as friends and professionals who choose to use identity-first language, see it as something that should be celebrated and embraced. In both et al. Conclusion on their recent research, they state, linguistics framing, including the use of person-first language, has material consequences for the autistic community, especially those who are not speaking. The priority of research should be to center autistic people, both speaking and non-speaking, and with and without learning disabilities, in the conversation around language used to describe autism and autistic people. It is within our scope of practice and responsibility to our clients to use language that has minimal to no harm, something that identity first language does.
Thank you, Diane and Stephanie, for summarizing the pro and con closures. Now I will provide some conclusionary comments for the pro person first language side of the debate. Based on the research that was used in the debate, it is important to acknowledge how those with disabilities would like to be identified. such as person first or identity first, and it varies depending on the person. Language and culture may impact the preference for identity autism first or person first language, as stated in 2023 by Boojman. Research shows that those who are shaped by their experience of interacting with autistic individuals rather than theoretically informed, as stated by Lee of 2021. And learning to be respectful when talking to someone that has autism can show how informed you are on a topic like pro-person first or pro-identity first, and those with disabilities such as autism. Now I will share the connections to the BACB Ethics Code for Behavioral Analysts 2020. The overarching core principle addressed is treating others with compassion, dignity, and respect. This person first versus identity first debate incorporates the BCBA Code of Ethics sections of responsibility as a professional and responsibility to clients and stakeholders. Section 1.07 is cultural responsiveness and diversity. Section 1.08 is non-discrimination, behaves equally and exclusively. Section 1.09 is non-harassment. Section 1.10 is awareness of personal biases and challenges. Section 3.01 is responsibility to client, do no harm. The co-connection for this is 5.01, protecting the rights of clients, stakeholders, supervisees, and trainees. Prioritize rights and public statements. Now I will ask questions that we have gathered from the debate project. Questions will be answered by Diane. Question number 1, is person first language used more frequently with children with a disability or with children without a disability?
So in our research, we found that oftentimes people with disabilities are spoken about in person first language. According to Gernsbacher, person first language is used considerably more frequently to refer to children with disabilities, while identity first language is used more frequently to refer to typically developing children.
Question number 2, do we as students of behavioral analysts have the bias or learning history that affects our preference for or against person first language or our recognition of other preferences?
So in our experience, our group members have identified through informal discussion and our survey of each other that our friends and acquaintances with disabilities are more likely to prefer identity first rather than person first language. We also recognize that our friends and acquaintances represent the adult subgroup, so the anecdotal reports do match the aforementioned research by Gernsbacher.
Question number 3. How should people choose whether to use identity first language or person first language?
Well, from the breadth of research that we consulted, it is central theme that it's considered most appropriate to use the language that the client or the individual prefers. This requires cultural humility as we learn the perspective of those with whom we're interacting.
Question number 4, is the person first language and identity first language debate relevant to people who cannot speak or communicate via other methods?
Yes, language usage matters for all individuals, even those who cannot speak or those who appear not to understand. According to Botha et al., linguistic framing, including the use of person first language, has material consequences for the autistic community, especially those who are non-speaking. The priority of research should be to center autistic people, both speaking and non-speaking, and with and without learning disabilities, in the conversation around the language used to describe the autism and autistic people.
Thank you, Diane, for answering those questions about the debate. And thank you, Tyler, Brenna, and Stephanie for providing research on this topic. At this time, we have completed our person first versus identity first debate in hopes that people will understand that words are important when talking to each other. Thank you.